does the name nightmare bacteria come from? What exactly is it, and how did we land on that name?
Good question. So the CDC started calling this a nightmare bacteria back in around 2018. It might have been a little bit before that, but at that point, we were sounding the alarm in the public health community because we were starting to see an increase in some of these bacteria. And so at that point, they put out a statement saying nightmare bacteria are in your backyard. But this time, when you're hearing about it, it's gone up a ton.
When you say gone up a ton, just put that in perspective. What exactly is a ton? What does that equal?
Yeah, so the resistant bacteria that we're used to seeing and that we have seen for the past 10 years, since COVID, this one type that is only susceptible to two antibiotics that are given IV has gone up 461%.
So, what is it about this particular gene that makes it just so difficult to treat?
Yeah, so because we weren't as worried about this particular bacteria, drug companies weren't creating new antibiotics to fight this bacteria. And I think as we lose public health funding, as we lose the ability to do some of this surveillance, we're getting further and further behind the ball. If we cut medical research, like Hakeem Jeffries was just talking about, we're not going to be able to get more drugs that could treat this bacteria. So right now we only have two, but I'm sure companies are thinking about making more after seeing this data.
For this bacteria, how does it transfer from person to person?
Yeah, so for this specific type of bacteria, we call it a bacteria that colonizes your skin. And there are many different bacteria that do that and don't cause any problems. But this one is particularly harmful in older people. It can cause, if you have a cut and the bacteria gets in a cut, it could give you a bloodstream infection. If it gets into your urinary tract, you could get a urinary tract infection. And both of those lead to sepsis, and that has a high mortality because we don't have the drugs to treat it.
I want to ask you this. I read a study where it says that the key to treating this could be what scientists classify as zoo poo. Is that where do we stand in terms of that being a potential, I guess, treatment for this? How are scientists potentially using, I guess, animal poo to help treat nightmare bacteria?
So the stronger our immune systems are and the stronger our microbiomes are, that can potentially fight these really resistant bacterias. And so it reminds us that we all have to stay healthy, take care of our chronic conditions, get vaccinated, stay as healthy as you can so you don't end up at a hospital or end up getting one of these infections.
Are there any warning signs that somebody has been infected with what we now know as nightmare bacteria?
So it's going to seem like a bacterial infection with any other bacteria. It's when the doctors start antibiotics on you and it doesn't work that they're going to start being worried about a drug resistant bacteria. And so it's going to take the labs longer to figure out that it's a resistant bacteria. And that time it took to treat you could be an important time that could save your life.
Is this something that we feel like is just maybe kind of a blip that we're seeing a lot more cases now? Or is this something that we're going to expect to see maybe going forward as it continues to grow stronger and stronger, it continues to spread?
Yeah, it's been going up steadily over the past few years since COVID. And a lot of that was because there was a lot of antibiotic use because we didn't know treat the virus at first drove some of these resistance mechanisms in the bacteria. So this will continue unless we can find some ways to have drugs to fight it.
And until somebody gets those drugs, if they do suspect that they are infected with this, what is the number one step that they should do?
They should call their doctor. And if they're feeling really sick, they should go straight to the emergency room. Every minute counts when we talk about bloodstream infections. So getting fluid and antibiotics as quickly as possible, in however you can do that, either by calling 911 and getting an ambulance to your house or going to the emergency room, that's what we'd recommend.